Hello, my name's Ria. I'm working in the breast screening program in the Western Trust as a radiographer, and I'm here to talk to you about the breast screening program and how we deliver that in the Western Trust. I'll cover what the breast screening program is, how we carry out the breast screening program, who is invited, and how you're invited. I'll cover what happens after you have your mammogram and when you're recalled to our assessment clinic, and I'll also cover the common signs and symptoms of breast cancer. What is the National Health Breast Screening Program? So this is a cancer screening program and it's used to detect asymptomatic breast cancers, which are cancers which are there before you can even feel them. So if you attend the breast screening program and have a cancer detected, it is usually at a very early stage. This is done using a mammogram, and I'll cover that in a bit more detail shortly. And we invite ladies aged 50 to 70 once every 3 years. Screening is currently delivered in two mobile units and at the static unit at Galvin Hospital. Our two units cover the entire Western Trust area and Coleraine, and these regularly move to ensure that all eligible clients are offered an appointment to be screened every 36 months. Below, I have included our current screening locations, and you will be invited along to one of these locations when we are screening your GP practice. So, what is a mammogram? A lot of ladies are concerned when they come for their first screening appointment about the mammogram and how it's done. So, it's a specialised x ray imaging technique of the breast. And we will do 4 images when you come to us, okay? And this covers the breast tissue and some of the lymph nodes from under the arm. The biggest concern we get is it going to hurt? And this is because we apply compression to the breast to get the x-rays. This compression only lasts for a few seconds at a time, and this will automatically release once we've finished x-raying your breast, okay? The compression is there for a number of reasons. It holds the breast still so we get a really sharp picture of the breast, and it also, if you imagine, we're x-raying a 3D object as a 2D image. So the compression acts to flatten the breast tissue out and it allows us to see the structures in there very clearly and separated from one another. Your mammogram will be carried out by female radiographers and assistant practitioners when you attend, okay, and it is a 5-minute procedure. It's very quick and it provides as little interruption to your day as possible. We like to get you in and out nice and quick and back to your day before you know it. So who is invited and how do we invite you? The programme is currently open to ladies aged 50 to 70 who are registered with a GP practice, and we will automatically invite you once every 3 years. Now, the letter won't come in the door smack bang on your 50th birthday. We can invite you anywhere from your 49th to your 53rd birthday, and that just depends on when we're screening your GP practice. Okay, so if you're over 50 and haven't been called, don't worry just yet, we will get to you, okay? If you are concerned, you can contact us and find out when we're screening your GP practice. Ladies over the age of 70 can self-refer once every 3 years, again, by contacting our static unit. You can make yourself an appointment. As I say, a letter comes to your home address and you're invited in batches relating to your GP practice. Is everyone suitable for screening? Anyone who wants to attend for screening, we will endeavour to get the best images possible. In some cases, a full mammogram may not be possible. The positioning for a mammogram requires some amount of upper body mobility. This can be difficult if you have mobility issues or chronic conditions which affect your mobility. It can be difficult to hold that position, and then that can mean it can be difficult for us to image all the breast tissue. If that is the case, we will let you know on the day that we were only able to do a partial mammogram, and we'll give you all the information relating to that on the day. Some ladies have cardiac devices implanted, such as pacemakers or loop recorders, and in some instances, these do cover some breast tissue. We will let you know if that's the case on the day and give you the partial mammogram information. If you currently have worries or concerns about your breasts, you should seek GP advice and a referral to the breast clinic for a full assessment. We often get ladies who come to us to say that they've had a worry on their breast for quite a while and they knew that their screening appointment was coming up, so they just waited and they were going to tell us. We will record that information. However, as radiographers and assistant practitioners, we cannot give you a clinical exam on the day that you attend for your screening mammogram. So it is really important that if you notice any changes out of the normal for you, that you seek GP advice and a referral to our symptomatic breast service. Ladies, under the care of another breast clinic, such as our family history or surgical review clinic, should not attend their screening mammogram, as these ladies are usually seen every year for a mammogram. We will still invite you. There is a part in the letter that says if you're under continuing care, please contact us and we can then cancel your screening appointment, as it is better to stay under the care of your family history or your surgical review clinic. And we do not invite ladies under the age of 50, and I'll cover the reasons for that now. So, ladies under the age of 50 are currently not included in the screening programme, and this is for a number of reasons. The risk of breast cancer increases with age, with 8 in 10 breast cancers occurring in women over the age of 50. Under the age of 50, a mammogram then becomes less useful, and because there are there is radiation associated with the mammogram, there's a radiation protection issue there. If the mammogram is not going to be as beneficial to ladies under the age of 50, we cannot justify screening asymptomatic ladies under the age of 50 every 3 years. Because although it is a very small dose of radiation, the effects can be accumulative. Also, mammograms are not recommended for women under the age of 35. This is because of the aforementioned radiation protection issue, but also because ladies under 35 tend to have higher breast density, and this makes the mammogram less sensitive. If you look at this image, these are all the different breast densities, okay, with C and D illustrating breast densities of women who are under the age of 35 or premenopausal. This is the typical breast density that we would see in that age group. As you can see, the mammograms are quite busy and there's a lot going on. As the breast screening program detects very small changes in the breast with very high breast density, that can make those changes that bit harder to detect. A and B are the breast densities of the ladies who typically attend for breast screening over the age of 50. As you can see, they're a lot quieter, there's less going on, and that makes those small changes that bit easier to detect. That being said, our symptomatic service is available to men and women of all ages. So ladies under the age of 35 and men of any age can be referred to our symptomatic service if you notice any changes in the breast. So what happens after you've had your mammogram? You've had your mammogram, we send you on your way. We'll tell you that you'll get a letter in the post in 2 to 3 weeks with your result. What happens when your mammogram comes back to Elton is that it's read by 2 different film readers on 2 separate occasions. And this can be a consultant radiologist, a consultant radiographer, or an advanced practice radiographer. And on 2 separate occasions, they will view your mammogram and form an opinion on it. They will either decide that no change has been detected and that the mammogram is normal. This is the result that everybody wants. In that case, you will be deemed a routine recall and we will invite you back again automatically in 3 years. In some cases, the film readers come together and they say, yeah, there's been a change in this breast that we would like to investigate further. In that instance, you'll be recalled to our assessment clinic at Altnagelvin and you'll have these changes investigated further. They will then either be deemed normal at that stage and you will be discharged and invited again in 3 years. Again, the majority of people that attend our assessment clinics have this result. In a small number of cases, the changes are deemed abnormal and you will then have all your imaging biopsy results referred to a multidisciplinary team meeting and be referred to our oncology and surgery teams for treatment and follow-up. So what happens at assessment clinic? A lot of people can be quite nervous when they get a recall and they don't know what's going to happen when they come to our assessment clinics. So you'll come back to our static unit at Altnagelvin and you'll speak with a breast care nurse to discuss the reason for the recall, and they'll also take a medical history to see if there's anything of note that the doctors may need to know. You'll have some extra x-ray imaging done. We can do magnification views, which zooms in the breast so we can see it more clearly. We can do compression views, and this allows us to see the structures in the breast more separated from one another. Or we can do a 3D x-ray or a tomosynthesis, which gives us a lot more additional information of the affected breast. Following the x-ray imaging, we will then proceed to ultrasound. And this is a more targeted imaging technique. Your radiologist will be able to identify the area change on your x-ray imaging, and then they will pop the probe on the breast on that area to view it under ultrasound. As this is a more targeted technique, it isn't offered routinely as screening because it doesn't give a good overview of all the breast tissue. We also have the ability to do any biopsies on the day that you attend for your assessment. So after all your imaging, the radiologist or consultant radiographer may decide to biopsy an area of change to send it for assessment to see if there's anything of concern. We can do this under X-ray or ultrasound guidance, and that will just depend on how the area change was best visualized. Some samples can be assessed on the day and you can have results on the day. If larger samples are taken, these will have to be sent to labs and you'll be invited back for another appointment for results after those results come back from the labs. Really important, I understand a recall can be very stressful and nobody wants to come back to see us at assessment clinic. But not everyone who is recalled to us will have a cancer. There are a number of normal changes that happen in the breast with age, but the doctors need to be 100% sure that those are normal, and that's why a lot of people come back to us for assessment clinic. Being breast aware is important for everyone, including the people that are attending for their screening mammograms. Knowing what's normal for you is also extremely important. So if you notice any of these changes, such as a thick area, dimpling on the breast, nipple crust, a red hot rash, any discharge from the nipple, skin sores or changes, a lump or a bump, nipple inversion, a change in size, orange peel skin or skin has changed texture, or a hard immovable lump, you should seek GP advice for that as soon as possible. Please do not wait to your next routine screening mammogram, because if you see your GP, they can refer you to our symptomatic service and you will see a consultant surgeon who will clinically examine the breast. You'll have all your imaging and everything done on the day. If you wait for your screening mammogram, you could wait 2 weeks for the results of that mammogram, okay, and then have to be recalled for assessment for the changes that maybe you've known are there for a while. So do not delay getting these changes checked because that could delay any diagnosis and then treatment for you, okay? And the biggest thing to take away from this today is that early detection saves lives. Your attendance at the breast screening programme regularly will vastly improve outcomes if you are detected to have a cancer. It's a 5-minute procedure once every 3 years, and it can greatly improve your treatment options and your chances. I want to thank you for listening, and if you need to contact us for anything or you've received your appointment and you want to rearrange, our contact details are on the screen and they can also be found on the Western Trust website. Thank you very much.